I'm Kim Pepper. I'm the chaplain at St. Peter's Health, and we are in the chapel of the Regional Medical Center, which is on the second floor right across from the main elevators. We are in the larger of the three spaces that we have. This space is open 24 hours a day, 7 days a week, for people to come in and be quiet, have quiet time, pray, reflect. One of many research studies have shown that a majority of people, around 70–75%, maybe even more, some studies have shown, is that when they're having health challenges, even minor health challenges to health crises, they turn to their spirituality to find comfort and hope and strength for what they're going through. And so we at St. Peter's Health want to make sure we meet those spiritual needs as well. And we also know that just as our physical health can affect our emotional and spiritual health, also our spiritual health can affect our physical and mental well-being as well. So we want to make sure that people, that the people who come to us for care, that we care for that part of them as well, to help them get better and heal even more quickly. So every person, when they're admitted, they're asked what their religious or spiritual preference is, and that's marked on in their medical record. They of course can change that at any time. They're also asked if they have a particular religious or spiritual community or spiritual support person that they would like contacted. And so part of what I do is I can connect them with their own spiritual support and support them as well, not meaning to replace their own person, but to be an additional layer of care. So we can contact their spiritual support person on their behalf and let them know that they're here and that they would like them to come and visit them. We also respect all religious and spiritual traditions and beliefs. People that don't identify with any particular tradition at all, we support them in that and still help them find meaning, draw on those things that bring meaning in their lives and connect them with those. I really want people to know that that I am here to listen and to be with them as they have questions, if they're worried, if they're afraid, that we have support, there for them, someone to be with them, to walk alongside as they go through hard times. They can come to this space anytime for quiet, to be still, to be able to get in touch with where they turn for comfort. We also have two other spaces. We have our cultural room where we can perform smudging ceremonies for our Native American people, and then we have a smaller room that's just off this chapel that's a little bit quieter, a little more intimate. But all those spaces are open and available.
I'm Daniel Pocha. We're at St. Peter's Hospital. We are in the cultural room that is adjoining to the chapel on the second floor, just off the elevator. This room was dedicated for the Native members of the community that are here in the hospital. This building room was made so that a person could come in here and smudge in a traditional way. But it was also built so it would be inviting for the patient or their family, so they could come in here and sit back and meditate and stuff like that. When one of our elders painted this room, she brought in the elements of nature that are real close to our heart. She's got the eagle bringing sacred plants, the water, the rocks, the turtle, the trees, so that it's inviting in a natural way, and that you could sit down and have them discussions that sometimes you need as a family. And I know it's a personal note that I've been in here and done that also with members where we have gotten in here and had some of them terrible, rough discussions that you have to have. But this setting made it much easier to do. And especially when you do it, when you start with the smudge, when we smudge as Native people, that those sacred plants we burn, we wash ourselves with that smoke and cleanse ourselves. So it's a cleansing, but it's also a healing. And we give our prayers, and being a very visual society that didn't have written traditions, we always believed that this smoke carried our prayers up to the Creator, because smoke always travels to the Creator, the one above. Little things and details we put into the room so that it would be comfortable in it. But one of the greatest things that come together with this room was a hospital made a policy to where if you were too ill that the nursing staff believed you couldn't come here, that they could come here and we provide them with the material so they could smudge in their room, and that they can facilitate with their engineers and stuff like that so that they safely can do that most anywhere in the hospital and in a very timely fashion. And that's one of the things we like the whole community to know, that the hospital realizes the need for our Native people to be able to pray in a way that's they're comfortable with, and it's their beliefs, and they're valued and important. Even the chairs take on special meaning, you know. I think here are 4 Indian head pennies, and the 4 represents the 4 directions. And 4 is a real powerful Native thing. We have the 4 directions, the 4 seasons, the 4 colors of man. So it makes it very important. And if you carry up to the back of the chair, there's 3 more, because there's actually 7 directions. These 4 represent the 4 points on the compass. The 3 above represents the Creator above us, Mother Earth below us, and the most important one is inner inspection of yourself, because these other things don't work without you carrying them thoughts and beliefs in your heart. But we as a group believe that the spiritual self needs to heal alongside of the medical. You got to carry a prayer in your heart with you to give you strength. And sometimes in a medical, in a sterile place like a hospital, it's hard to do that. I'm wearing some bear medicine that was given to me while I had to stay in this hospital last year. And I don't know if it was the doctors or this prayer that healed me, but I think it was a little of both. And I believe that happens to a lot of people.